As Celine said, we've actually been very fortunate as Medical Aid Films to have been funded by the Funding Network on 2 different occasions. The first was in 2013 for a project to develop new content in Somali, which was really amazing for us. And then secondly, last year we were part of a strategic funding group, and we pitched for a really transformational project to develop our data as an organisation. And between those 2 projects, really, the funding that the Funding Network has supplied and provided has really transformed our organisation. And so it's an absolute pleasure to be able to come back and talk about our work. And now that strategic funding group funding was for this very, in many ways you might say dry, project to actually develop our use of data. So I thought it might be more interesting for the group as a whole just to actually update you on all that we do as an introduction to our charity. But if you want to know about that specific project, I'll be more than happy to talk about it afterwards. So, who are we? So Medical Aid Films is we use film to transform the health and well-being of women and children around the world. And we bring together medical and health expertise along with creative filmmakers to do that. We were actually founded back almost 10 years ago, and it was really in response to the global crisis in maternal and child health. Now this is the context that really every year millions of women and children die needlessly as a result of complications of pregnancy and childbirth. Those deaths are largely preventable, and 99% of them occur in developing countries. And the challenge is that so many of them, they are issues of resources, lack of access to services, but also a critical lack of access to information. And so we use film as a really engaging, inspiring medium to reach people, from health workers to people in the community, with truly life-saving knowledge and skills about maternal and child health. So with the support of the Funding Network, we have really transformed them over the past several years. We have actually 260 films in about 46 different topics. Films about content from nutrition in pregnancy, to newborn resuscitation. And those films are available in 20 different languages. We're talking English, French, Swahili, Somali, as the Funding Network funded, Luganda, Bemba, and many more. And they're created and used in partnership with organisations from global NGOs through to academic institutions, and really many, many local individual partners working on the ground with whom we have a really close partnership, and through whom we deliver really, truly life-saving education and skills training. And having created content, we share it. We share it widely with, quite frankly, in the last year, over 2 million people accessing our content on YouTube, as well as distributing it on DVD, on USB. And it's used in so many different ways. We're talking on TVs in waiting rooms in Uganda, on handheld projectors in Zambia, on mobiles in Zimbabwe. So with Econet, a mobile operator in Zimbabwe, we are starting to share malaria-focused content on mobile, which has no data charges. So it's an amazing way to reach people, really, with, again, life-saving information. And just wanted to give a sense of some of the recent work that we've done. So, firstly, one of the real global health challenges at the moment is diabetes, but something that is often unrecognised is gestational diabetes. So that gestational diabetes during pregnancy. This affects 3.7 million women at the moment, and we produced a film to raise awareness about prevention, about healthy behaviours, and how to avert the potential onset of type 2 diabetes, which often occurs following gestational diabetes. And another quick film, so at this more skilled end of the spectrum, postpartum hemorrhage, so bleeding after birth, is one of the major killers in the developing world, really. 30% of all maternal deaths are a result of postpartum hemorrhage, and yet one really, really simple and resource-appropriate way to manage this is a really novel device called the uterine balloon tamponade. So you can just about see this is a combination of condom, a catheter, and a syringe that, put together in the right order, they create an amazing kit.
That's the challenge.
Yeah, that is a challenge, and that's why you need a film. So it helps to avert bleed, or to temporarily prevent bleeding in the time that it takes to get a woman to a facility. So we worked with Mass General Hospital in the States, working in Kenya on a big program to create a film that would educate really community health workers about the use of this device in order to prevent bleeding temporarily and get women to a facility. So what's the difference that all this makes? Just wanted to give one example of a project in Democratic Republic of Congo, where we're working with Food for the Hungry, who have these amazing groups called mother leader groups, where they engage with women at the community level. They use flip charts like this, but they also now use films as part of their training. And we found that we had some amazing figures just last year, where as a result of using films in training, we saw amazing increases in knowledge. So for example, up to 50% of women being able to identify warning signs of ailments in the newborn, but also critically changing behaviour. So 18% of women we found following these education sessions were accessing their 8-month recommended health check after a baby's born. So all of this, it really demonstrates, in my opinion, I hope in yours, that film makes a transformational difference to the lives of women and children. And none of this would be possible without the support of organisations like the Funding Network, and of course like people like you. So if you have any questions, I'm here afterwards, and thank you very much.
Please make sure to